Hello everyone, welcome to the new video of case of varicose vein. How to write the case and how to do the examination is described in this short video. I am going to describe the important points in history and the rest of the format will be same just like the other case. In patient particulars, there is only one point important, that is the occupation of the patient. If occupation involves long-standing hours, that should be mentioned in the history as it is one of the important risk factor for the occurrence of varicose vein. Now, what are the chief complaints the patients will present with in case of varicose vein? For this reason, we have to first know what is varicose vein. If the veins become dilated, tortuous, and elongated, then it is called as varicose veins. Varicose veins seen mainly in the legs. Also, it is seen in rectum and esophagus. In rectum, we called it as hemorrhoids or piles. Esophagus is esophageal varices, and in legs, we called this as varicose veins. One of the most important thing is there is incompetent valves, the valves that are present between the superficial and deep veins. So this is the normal vein and this is the varicose vein. Now let's focus on the chief complaints. The patient usually complains of swelling in the leg across the veins, just like because the veins become dilated and tortuous, pain in the right or left lower limb, pigmentation, and one important thing is ulcer. Now we will focus on the history of present illness where we have to describe the chief complaints one by one. Swelling, pain, pigmentation and ulcer, these are usually four presentations. In swelling, the onset, duration, progression, these things will be there. But one important thing is its relation to the standing and walking. And if swelling is present with pain or color change, if the swelling is present with pain or color change, it will indicate towards thrombophlebitis. It may be asked in the viva. Now, the history of the pain to be described just like the other history in onset, site of pain, character, dull aching or what. So, in case of varicose vein, normally the pain is dull aching. But if the pain is occur during walking, it is suggestive of intermittent claudication, where intermittent claudication where a calf pain happens after a period of walking or doing exercise because of the narrowing of the vessels either due to atherosclerosis or any other reason spasm. So these 2 points are important in swelling and pain. Mostly the patient will present with swelling and pain, and in advanced cases there will be ulcer or pigmentation. Now, one more thing is important in the past history. If the patient has history of fever, pain in the calf and fever and sometimes ulcer, then it indicates towards the past history of deep vein thrombosis. So why the history of deep vein thrombosis is important? Varicose vein can be of two types, primary and secondary. One more thing is congenital. So the primary that is occurring by self and the secondary is occurring mainly from the deep vein thrombosis. So history of the deep vein thrombosis is very important. Now let's focus on the examination. In general examination, all the points just like the pulse, BP or other vitals, pallor, icteria, cyanosis, clubbing, edema, that should be mentioned like the all other examination. There is no special points in the general examination. In local examination, we have to first point towards the inspection. On inspection, we will look on the diseased limb first. So the complaint, if the patient is complaining of swelling or pain in the right limb, then we will focus on right limb first. First in the supine position, then in standing, and then we will show that we will see that which system is affected. That means the great saphenous system, that is mostly in the upper part, short saphenous vein. So we have to look which system is affected mostly, and all other, if any other system communicating veins and the tributaries, and if both great and short saphenous vein is affected, so we have to check that. We also have to check the attitude and deformity of the limb. We will check the extent of the swelling, like if it is extending from the foot to the knee, or from knee to the hip joint. So we have to also mention the extent of the swelling. Now we have to look for the skin, if there is any pigmentation, eczema, ulcer, or venous star. What does it mean by venous star? Is like the spider angioma. A lot of veins feeding in the single vein. This is called as the venous star. What is cuff impulse? We have to also check the cuff impulse. Cuff impulse means when the patient is coughing, if any impulse is following through the saphenous vein, or the the vein which has got swollen, it is called as the cuff impulse. First, we have to see in the process of inspection.